Hi. Just a question with regards to the biomarker initiative. With the development of drug discovery and so forth, is the plan to use the biomarkers to determine whether the drugs are effective in Alzheimer's disease? And in that way, how do you determine whether they're disease modifiers in that same way? And I'm thinking more from a phase 3 results and outcomes to determine whether these products are useful or not.
Well, I mean, obviously for each disease-modifying mechanism, you would have your own sort of pharmacodynamic readout. But I think if you're looking at such a battery of neurophysiological, neuropsychological and so on, if it didn't do anything against any of those readouts, you know, you'd be very worried about it actually modifying the disease. I realise, you know, it's not foolproof, but and for instance, you know, with the amyloid lowering, it will be very interesting. We haven't done the experiment yet, but to see whether these amyloid lowering agents were able to alter any of these functional endpoints. If you can't show that, then I think we're in big trouble, basically.
So I suppose my question goes a little further than that, because I'm thinking about the BAPI study that was done recently between Pfizer and Janssen, and one of the outcomes there was cognitive improvement as part of an efficacy endpoint to see if the product was useful or not. So looking at those endpoints and mapping back towards your markers, how then do we determine disease modification and whether those endpoints are rationally?
Well, I think that comes back to what I was saying about work package 5, that, you know, you're trying to see whether this biomarker matrix correlates to the cognitive deterioration over the 2-year period. If it doesn't, then, you know, we wouldn't be able to use it, basically.
I think we're going to have to just hold that. We can have a discussion on that maybe at the very end. It's a good question.